You're listening to Health Professional Radio with Wayne Buckler. My guest today is Michelle Harris. Michelle's a dementia consultant with the Bethanie Group and is currently in Western Australia. Michelle, welcome to Health Professional Radio.
Thank you. It's lovely to talk to you.
Now, Michelle, just to put a bit of context around what we're talking about, give us a bit of insight into the Bethanie Group. What does it do and how big is it?
Yeah, well, Bethanie is founded on the Churches of Christ ministry over 60 years ago, but it's now called Bethanie. And we are a not-for-profit organisation that looks after retirement living, social housing, respite services in the home or residential or permanent care from Geraldton in the Upper Gascoyne region right through to the southwest in Dalyellup. So we probably have about 3,500 clients with about, I'd say 1,600 staff and over 700 volunteers.
That's a very big group.
Yeah, it's fabulous. It's, the independent living and retirement living, I guess, here is growing. But the fact that we're seamless, where you have like a constant opportunity to get access to stay at home as you age, with service right till the end of your life, or you can have more and move into a residential service. But I think with the increased emphasis now on living well and consumer-directed care, there is a more, I can see a more increasing, the population is looking at more services like us to look after you and support you to live autonomously but well. Yes. Despite any disability, whether it's a physical or cognitive disability from dementia.
Now, speaking of dementia, that's your area of expertise these days.
Yeah, that's right. And we've just had an amazing 30 days with 22 events where we've actually been out talking to our community and general public, family carers, staff, about our approach to dementia and how we want to bring people forward with being more dementia friendly. I think this is across the globe, which we need to reduce the stigma and the myths about dementia. And a lot of people still believe that, dementia is an illness that can be cured, or that it is an illness where your life is over. And what we're trying to do is just the same way people with physical disabilities are enabled to live well in the community, with education, with good care planning for the symptoms of distress, and also forward care planning. So we forward plan for the future. We're looking at our partnerships as being a key focus of our approach to care, because the person that knows the person with the cognitive disability is the person that loves them the most, that's been with them in their life, or friends if the family are no longer around. So we need to work together, not independent of the family. Education, really important for the staff to be competent and confident, and also for the general public to understand how to communicate, and also talk about assessments of communication and what can work for people, because everybody's different. That's one of the myths that say everybody with Alzheimer's disease has the same experience, or everybody with vascular dementia has the same experience, and that's totally incorrect, because every single person is unique, and they're still unique living with dementia. So the other part of the partnership and communication and the approach to care is well-being. And we really know that there's a huge emphasis at the moment in reducing psychotropic medication across the world, because we know that the research is showing us that it's not working, it's not supporting people. It works while it's in the person's system, and then when it wears off, the person wakes up and feels just as bad as they did before. So a pill, for some people, for example, with depression and dementia, it can support. Obviously, with any infection or pain, that's really important that we look after those people well and make sure they get the right medication for that. But if we do all that and we still don't give an approach that includes well-being, then we're actually causing ill-being. So if I can, have you got a few moments for me to talk to you about well-being?
Yeah, sure. It's fascinating to hear you talk about it.
Well, thank you. Well, well-being is something that fascinates me, because being in the medical profession and seeing people over the years in and out of the doctor's surgery, in and out of hospital, but if we focus on these elements of well-being, so I'm saying now that the person we're looking after with dementia has got no pain, we've assessed that, there's no infection or delirium or depression, so all those things have been excluded. But if we approach the person where they are still connected to us, so to be connected, we need to know a little bit about the person's life history. So you're speaking to me now today from the Philippines, so that's significant in your life story. So wherever the person's lived, worked, enjoyed life experience from the past, because we know that those memories from the past can often still be around.
Mm-hmm.
The short-term ones, like what we had for breakfast this morning, may not be there, but the long-term. So if we can connect to what the person lived, how they lived, if we can promote their identity and give them meaning in their day. So when you're doing something for someone with dementia, including them, not doing everything.
Yes.
Obviously, people that are even chair-bound and bed-bound with dementia can often hold a dog or cat or support somebody by touch or feel connected by music. If we help the person learn new things, so if the person is able to walk around but has has really what we call apraxia, where people can't sequence things, if we help start them off with something and are patient and spend time, so it might be making a cake. We use volunteers for things like this, or working in the garden, or being part of a community, just participating in a singing group, even if they can't read the words on the song sheet. The music may stimulate some memory of the words that are being sung in the music, or just the connectedness of being with people around them. And then autonomy, if we keep taking away everything, if we keep thinking that people with dementia have to be locked in a community where nobody can escape, and we reduce their freedom and autonomy, then we're actually taking away their rights, their civil rights. And really, there are GPS devices, there are communities at Bethanie that are secure, but there's lots and lots of garden and lots of areas to find to occupation. And that occupation can be in or outside. And learning new things. We know that the brain cells, even though many of them are deteriorating, there are still cells that regrow. So we know that when you challenge your brain and you learn something new and you do physical exercise, then you're actually supporting the person to live well. So if you look at that as a puzzle, so I've got a picture I can send you where I've put all these in a puzzle, and I say to staff and family, if you take away a piece of this puzzle, what do you get? And often it's ill-being, and that's usually apathy, so people not interested in anything, sadness, anger, verbal anger, refusal of care and support, isolation, or even complete hyper-anxiety, frustration, and really a feeling of disablement. People that fiercely feel, that everything's been taken away from them, so losing their memory and then having people disable them by not approaching them with a well-being approach can actually make the dementia worse. So I've taken all this and looked at it, and I've read lots of books and research, but I've been out and seen it and done it myself. And when I've said to the person that's caring for someone with dementia, what can your dad or your mum still do, or what can your brother or your father do? And that's the focus. Work from there. Don't work. Yes, we need to know what level of support they need, but let's focus on what they can still do, and let's celebrate that, even if it's something something that seems so menial to us, like putting flowers in a vase, or picking some heads off some flowers, or just being in the moment with someone, enjoying laughter, massage or music. It's actually giving a sense of well-being. And years and years ago, back in the UK, I worked in, before I started nursing and midwifery, I worked in nursing homes, and I guess what I saw was a sense of ill-being, because people were just sat around looking at each other, staring at each other, sadness and disablement, and and that's not, to me, that's not living, that's dying in dementia. And I'm talking in my role about living in dementia. We're all going to die of something. None of us are immortal. So, if I said to you, you've got heart disease or lung disease, well, we'd still be focusing on what you can still do, and we'd be maximising that, not focusing on death and not doing anything. So, but there is this myth, you see, that the person is not there or they can't. I've got many clients who can read, but they can't speak to me.
Mm-hmm.
But they can follow instructions, but they can't follow the instructions without prompts and support and symbols. So even something so simple as going to the toilet, a door that's closed, but if you open the door and they can see the toilet, or there's a picture on the door that shows a picture of a toilet, it can actually prompt. So during this month, it's been amazing when you've spoken to people about it and they've tried it. I've had some really good results back and feedback to me of that gives people hope, and I think that's important. I think any organisation that predominantly has people over 65, and of course, I must say, dementia is not a normal part of ageing, but people over 65 and most over 85 have some elements of memory loss and cognitive decline, just the same as, you know, any aging organ. Your brain ages as well as your heart. But if we focus on well-being and if we say that every person is an individual and no two people have the same experience, then we can actually provide person-centered care. But there's a lot of rhetoric and people don't understand it. So I've tried to put it in a simple term, because a lot of the neuroscientists are working really hard, and that's wonderful to see that there's going to be some great, you know, changes, and hopefully we will find a cure. But while we're waiting, while the world's waiting, we need to focus on building hope and promoting a dementia-friendly environment.
It is a very positive view that you have, Michelle.
Yeah, and I'm talking about it at the World Congress in November, because I find, again, when I wrote my abstract for that, and it's, you know, lots and lots and lots of doom and gloom, you know, that this has been tried and this has not worked. And I think there is still hope, just the same as when the guys in Perth found the cure for duodenal ulcers with the antibiotic therapy.
Yep.
People were dying of that years ago when I was born. So now that's cured and preventable. So there are lots of articles and information online about preventing and maximising brain health. One of them I recommend your listeners to look at is the Brain app from Alzheimer's Australia. It's 5 simple steps to maximise. You can download the app, or you can just go online and look on Google and learn some of the exercises that they've got. But also physical exercise, you know, something as simple as gardening and doing a walk every day. Moving the blood from your feet to your brain cells is so good, you know, and often because motor skills decline for some people, so for example walking can be difficult, you can actually get support from a physiotherapist. And at Bethanie there are lots of allied health professionals that work across the community and residential care as part of their package, depending on what level they get assessed. Those that don't on a package, we can support them in other ways, like through Medicare. But it's really important that we support people to walk, we support people to eat well. So things like swallowing problems, we can actually modify diets to support people to eat and drink. Nutrition, again, without good nutrition, your brain cells don't thrive. So, yeah, it's really important that we keep moving despite any disability, as we know. But we know that, you know, the myths out there, it's all doom and gloom. So let's try and look at it in a different way. And that's what dementia awareness has been. And the other person I look at is the younger onset clients living 65 and under. That's increasing. But there's also increasing awareness around supporting them, and Dementia Alliance International, and one of my colleagues, Kate Swaffer, lives with dementia, and she's a co-chair of that organisation. It's a global network. I'm sure there'll be people there in the Philippines who know about it. Go online and look at it and be part of it. You have to be living with a diagnosis of dementia or supporting a family member, but they give some great examples of people achieving and doing things, studying, learning new things, living, and not being stigmatized and prescribed disengagement, as Kate talks about, which often is what happens. You know, go away and make ready for your end of your life. Well, how hopeful is that when you know that's what gets told? That's quite shocking, really.
What do you think is the biggest misconception about dementia?
The person's not there. The person, everybody has the same experience. It's totally not true. I've looked after people, family and clients over 35 years, at the end of life and they still know your voice and they still feel your touch and they still recognise elements. Even they may not look at you and know who you are, there are elements that you can jog memories, and that's so important. Never underestimate a person with dementia.
Never underestimate. It seems like a good message to leave.
Yeah.
Perhaps we can get some of our audience to dispel a little bit of that misconception today. Michelle, thank you very much for joining us. It's been a pleasure talking to you.
Anytime. Thank you.
Your passion is so evident when you talk, and so it's been a pleasure hearing that in your voice.
Thank you. Thank you so much.
I've been in conversation with Michelle Harris, who's a dementia consultant with Bethanie Group. And if you've missed my conversation, I do suggest head off to our website. We do have a transcript of it there. There's also an audio archive on YouTube and SoundCloud. Now you can find out more about Bethanie at www.bethanie.com.au, or if you're looking for that transcript, it's on the Health Professional Radio website at www.hpr.fm. My name is Wayne Buckler. Thanks for listening.